Hello and welcome back. So, if you're new here, my name is Joseph Tsuma, and I'm a clinician by profession, and I will be taking you through a very important topic that affects mostly our women, that is pelvic inflammatory disease. Now, if you're new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels, at Doctor on Wheels, and you can also follow us in our social media platforms, that is Saudi Premier Hospital underscore Ngong for our Instagram page, and Zawadi Premier Hospital Ngong for our Facebook page. Now, before we dive into today's topic, I want us to start with some words of wisdom. Let's listen to some words of wisdom from the book of Lamentation, chapter 3, verse 23 and 24. And the Bible says, "The steadfast love of the Lord never ceases, his mercies never come to an end. They are new every morning, great is his faithfulness." So let's look at pelvic inflammatory disease. So what is pelvic inflammatory disease, or PID in short? So this is inflammation and infection of the upper genital tract or the upper female genital tract. And when you look at upper female genital tract, we are looking at the uterus, okay, what we call endometritis, and then infection affecting the fallopian tubes, and that is ophuritis, or no, that is salpingitis, and then infection of the ovaries, that is ophuritis. Now, and then as well as the infection can actually spread around to the peritoneum and all that. Now, what are the major causative microorganisms that cause pelvic inflammatory disease? Number one, by far, are these microorganisms that are sexually transmitted, like chlamydia, trachomatis, and then Neisseria gonorrhea, that basically causes gonorrhea. And then we have other mycobacteria such as E. coli, and E. coli basically it's a normal flora in your gastrointestinal tract. So basically it's more of contamination. When you wipe yourself and you get it from the anal region, you introduce it through the vaginal canal, it can easily go up. The other microorganism include Gardnerella vaginalis, okay. Gardnerella vaginalis can cause that. And then also you can have Bacteroides fragilis and also Streptococcus. So by far, those are the common microorganisms that can cause this infection called pelvic inflammatory disease. Now, let's look at the people who are at risk of getting this infection. So number one, by far, people who are at risk of getting this infection are, number one, people who have multiple partners. Okay, so you have this partner, sleep with this partner, then after that you go ahead. So you can easily transmit it from one person to another. Number two is people who have unprotected sex. So if you have an unprotected sex with someone who has gonorrhea, okay, you can easily get the infection. The infection can easily travel all the way to the uterus, okay, and it can affect the uterus. So unprotected sex. Number three is if you had previous history of pelvic inflammatory disease, then it means then you are also at actually an increased risk of getting the infection. And most of the time is because probably you were treated and then the treatment was not complete, so then you ended up, the microorganisms did not completely get eradicated, so you end up getting they can continue to multiply, okay. And then number four is patients who have had recent insertion of an IUCD. Okay, so if the process of insertion of that coil, intrauterine contraceptive device, was not done in a sterile manner, it's easier for you to introduce infection into the uterus. Okay. and then recent history of abortion or miscarriage or even childbirth. Now, there is something that we need to understand here. Okay, why is it that it's easier for you to get cervicitis but it doesn't go up? It's because around the cervix, okay, there is something called a mucus plug. Now, that mucus plug basically blocks anything that goes up to the uterus. So it's easier, you can get cervicitis, infection of the cervix, but then the infection does not go up because of that mucus plug that acts as a mechanical barrier for any passage of microorganisms all the way back up to the uterus. But here, when you have had a childbirth, it means then that the cervix dilates and opens. Therefore, it's easier for infections to go up. If you have had insertion of coil and it was not done well, that coil can actually go with those microorganisms. Okay. Yes. So those are by far. And then the other thing that can actually increase the risk of this infection is something called douching. So douching is basically where you clean your genital area with some um, detergents that are very strong. Okay, so some chemicals. Okay, and some people do it thinking that it helps to clear some infection around the perineal area, but actually the truth is those strong detergents, they kill the normal floras. So the normal floras are those microorganisms that are present around your genital tract that keep the bad microorganisms away from infecting your genital tract. So when you wash with those strong chemicals and detergents, you actually wash them away, and some of them you kill them, and therefore you make the place more vulnerable for the bad microorganisms to be able to come in place. And they also alter, of course, the pH of the vaginal area, and therefore it makes more infection or microorganisms to basically multiply even more and more. Now, the other thing that can increase the risk of developing this infection is when you have had history of sexually transmitted infection. So, with a history of sexually transmitted infection, you are at increased risk of developing pelvic inflammatory disease. Now, how does the infection get up there? So, first of all, you have an infection at the lower genital tract, that is something like cervicitis or vaginitis, and then that infection can easily spread. So, most of the time with pelvic inflammatory disease, it is more of an ascending infection. So, it starts from down, okay, either vaginitis, infection around the vagina, or cervicitis, and that infection can easily ascend all the way to the uterus, causing endometritis. It can spread through the fallopian tubes, okay, causing uveitis, salpingitis, and then it can spread to the ovaries, now causing uveitis. Now, the response is that you'll have inflammation. Okay, so there will be a lot of inflammation, and then with an infection, you can easily get pus that is formed, but also some abscess. So, abscess is accumulation of pus. Okay, now, under normal circumstance, when you look at the progression of the disease, is that at some point you will, even if it's not treated, there are certain percentage of people that will still be okay. Okay, they will get healed, but at a risk of development of scar formation. So look at this scenario. Okay, you have some infection in the uterus, so you basically develop some wounds that end up with some pus, okay, and the pus keep on discharging out through the discharge that you see, that we'll be looking at when you look at the signs and symptoms. So those two wounds end up healing, and they heal with some scar formation, okay, so that tissue there is more of a scar tissue, okay. So what will happen with that? It means that you can easily get a wound from this side and a wound from this side, and because the uterus is actually the walls of the uterus in an unpregnant woman are against each other, the wounds can actually heal and get attached together, okay? And therefore you can have a uterus that has some two porches because of the uterus. Some areas have healed and they have touched one another, okay? And that condition is called Asherman syndrome. Okay, of course, there are other causes that can cause that condition called Asherman syndrome, but that one is one of the major causes. Okay, and with Asherman syndrome, it means then one of the complications is you will end up with a lot of infertility. But before we go that is the process how the infection basically grows. Okay, so how do patients present? Okay, so they will present with lower abdominal pain, so they will feel pain around the lower abdomen. They will have a discharge, okay, vaginal discharge, and this discharge is purulent or it is pus-like, false smelling. It can be a bit yellowish, greenish discharge, okay, vaginal discharge. They will also have intermenstrual bleeding, so they will have abnormal uterine bleeding, okay. Sometimes they get some spotting, and then their menses come to an end, and then before that, after sometimes they also get some spotting again and all that. And then with the spread of the infection, we have looked at it's an ascending infection. So it can ascend through the genital tract, but it can also ascend through the urinary tract. So if it ascends through the urinary tract, you get urinary tract infection, and therefore it will present with pain when you pass urine. Now, with the inflammation, okay, where every time you have sex, you'll feel pain, what we call dyspareunia. So there will be painful intercourse. And according to the severity of the infection, patients will also present with fever and chills, and also the feeling that, the whole of your body is just weak, what we call general body malaise. Okay. Now, when we do the examination, of course, when you palpate your abdomen, you will feel some tenderness around the lower abdomen. Okay, you can also feel some pain, especially if the ovaries are affected. Then you will feel some pain on the left and the right side. Okay, and then there's something called cervical motion tenderness, and also if you have an abscess, especially at around the ovarian region, then you can have what we call adnexial masses. Okay, so what are some of the complications if you don't get treated? So I will the treatment basically varies, because once you have made a diagnosis, you need to be treated with some good antibiotics, and so that means then anytime you present with any of those signs and symptoms, you need to rush to the hospital. It's not just don't say that it's just a vaginal candidiasis and you go ahead and buy something to insert down there. No, you need to be assessed, okay? Especially if you present with the above symptoms that we have talked about. Now, the complications that come with untreated pelvic inflammatory disease is that you can end up with those abscesses. And those abscesses, once they burst, okay, they can burst and pour all that pus to the peritoneum, and it can easily cause a very bad infection called peritonitis, okay? And then with peritonitis, sepsis comes in, okay? But then for the long-term side effects is that the healing with scar formation, okay? If the fallopian tubes, they heal with scars, and those scars basically touch one another. They can easily cause blockage of those tubes, what we call tubal blockage. And with tubal blockage, it can cause two things. Number one is, if it's partial blockage, it can cause what we call ectopic pregnancy, because the sperm can pass, go fertilize, but then the ovum cannot pass through to be able to be implanted in the uterus, so you can get ectopic pregnancy. Now, if you have complete blockage of the tubes, it can cause infertility, okay? But also with those additions, okay, and those scar tissue that has formed, you can actually have chronic pelvic pain that can accompany that, okay? Those are some of the major complications that you basically need to be aware about, okay? So, of course, treatment, you need to be given some antibiotics, and for quite a long time. So IV antibiotics, but also oral medication that you need to go home with, okay, that you can use at home for a period of 10 to 14 days. Now, how do you prevent pelvic inflammatory disease? Number one is you need to be aware that it is an infection that can easily be transmitted through sexual contact. Therefore, you need every now and then, if you're a person who with multiple sexual partners, you need to be able to use protection. Okay, but also regular screening is very important, especially for people who are at risk. Okay, so people who are at risk are those people who basically present with the symptoms. Okay, vaginal discharge, lower limb, low abdominal pain, pain when passing urine. You need to get regularly. You need an urgent assessment to be able to actually ascertain exactly what might be causing these symptoms. The other thing is you need to try to limit the number of sexual partners, okay? So being faithful to one partner. And then for us as medical professionals, we need to be able to practice what we call safe practices when we are inserting such family planning method like an IUCD, okay, or intrauterine contraceptive device, what we call coil. So it needs to be inserted aseptically so that we don't introduce microorganisms into the birth canal, okay? But also we need to avoid unnecessary vaginal instrumentation, okay? There are those people who keep on inserting things inside the vagina, things that are not recommended to be inserted, okay? There are people who use different methods of sexual satisfaction, and therefore they can easily insert a lot of things there, and then that one can actually increase the risk of developing pelvic inflammatory disease. Okay, so and then try and avoid douching. Okay, if you're a person who does that, practice washing around your perineal area with those strong chemicals. You need to avoid that so that you reduce the risk of developing this infection. So by far, those are the things that you need to be aware about pelvic inflammatory disease. Now, if you have any question about this disease, please don't hesitate to text, comment below, okay? And I will take time to be able to read your comments and be able to respond accordingly. If you're new here, please consider subscribing to our YouTube channel at Doctor on Wheels, okay? But you can also follow us in our social media platforms. You can also visit us if you present with any of these symptoms and you are around Nairobi. You can visit us at Zawadi Premier Hospital. We are located at Lupsil Center, that is opposite Juango Petrol Station in Ngong Town, and we will be able to attend to you, and I'm sure you'll be okay. Until next time, God bless you so much.